Okay, we've got two parts here to this video. One stopped. We're going to try to link them together here. You might have two entries for this particular chapter. Technicalities, they say the devil lives in audiovisual equipment, and so that's what happened. So I'm going to try to pick up where I thought I ended, and I may be repeating some of this. We're talking about the hamstrings, and I was talking about how important it is to know that, for example, if we're talking about running, and we talk about sprinters who are running maybe 100 meters, it's not uncommon for them to pull a hamstring. And a lot of times we blame that on cold weather or maybe a lack of stretching. But oftentimes, and probably more than often than not, it's a lack of training, because you have an inherent strength, less strength in the ham than you do in the quad. So think of it in this way: as you're running and you come through in the lower leg in recovery, it's the quad that is initiating that action. Okay, so the lower leg is coming through, but you don't want it to come through much more than 30-40 degrees, so you have to stop it. Well, what stops it? Well, it's the hamstring. So the hamstring is, to some degree, putting on the brakes. Now, think of that in your mind as you're really running full tilt, and you are extending the lower leg, and then you're putting the brakes on with the hamstring. That's when you're probably going to pull the ham. And so when you see somebody coming down the back stretch or the home stretch, and they pull up, that's probably what happened. I'm not sure how many of you have ever pulled a hamstring. I've only done that one time, and that was when I was older, out of competition, probably 35 years ago, but I was trying to sprint just a 40 or something like that, and you pull a hamstring. Now, those of you who have done it, one of the first, besides the pain, one of the first things that you notice is that it begins to bruise. And what's one of the most bizarre occurrences is when you, over time, over days and weeks, you begin to see that bruise go lower and lower in the leg. It's just a matter of gravity, basically. The gracilis muscle. This muscle is one that if the distal tendon of the gracilis is the one that you're going to feel most medially on the underside of the knee, and it's a knee flexor, obviously, but it's also a hip adductor. So it's pulling the legs toward the midline, and it's also called the horse riding muscle. And if you've ever ridden a horse for a long time and you are hugging the sides of that horse, I haven't done much horse riding, but they say that when you get off and you've been doing that, that's where you're mostly sore. One other comment in regard to the hamstrings and the gracilis is in regard to its use, the tendon, the distal tendon, its use in terms of grafting for an ACL surgery. I would encourage you, if you have not already done so, to take a look at some of those online. They're abbreviated usually. You don't have to watch the whole thing, but it's fascinating to see them take a part of the distal tendon, usually of the semitendinosus, and they'll use that in place of the ACL itself. So you're replacing muscle tissue with tendon tissue. It's a fascinating deal. Initially, doctors used the patellar tendon. They take a portion of that. Some still do, but a lot of them tend to use distal tendon from the hamstring. and it works just as well, sometimes better than the muscle itself. Let me just re-emphasize that as you go through this chapter and the next chapter, you're going to come across a lot of muscles that are double jointed. They cross two joints, and because of that, when you have one action, you're going to compromise another. So if I am flexing my knee, then I'm going to have it's going to be more difficult to flex the hip at the same time, because the sartorius is a flexor for both, and so there is a compromise